Welcome everyone to the July Learning Community, where we're going to cover some privacy and security topics around health IT. Thank you for joining us tonight. We are excited to share some of this information with you, and I hope you all can see us okay and the presentation that we have online. We have an agenda here tonight where we will we're going to do an introduction of who's here in the room, and then we will have a presentation for you. We'll talk about what's happening in the industry, and then we'll open things up for discussion. So I'm Tracy Mastel, Program Director for the Health IT training here at Normandale, and I have a couple of people sitting next to me, Moni Islam and Jen Ortiz. They are instructors with our program. So with that, I'm going to pass things off to them to go ahead and get started.
Sure. Yeah. Thank you, Tracy, and welcome everybody to our presentation today. So it's a very, very interesting and cool topic that we have, privacy and security. So what we thought we'll start with is what does it mean? What does the word privacy and security mean? So we thought we'll just define in terms of our industry. You will hear many different definitions, with the privacy and security, but within HIT there are a few words that you will hear almost all the time, such as confidentiality, security or security measures, IIHI and PHI and all that. So just the way it sounds, the confidentiality is with any other industry. Anywhere you have some sort of data or information, whoever hosts it, they have a responsibility to maintain that data and not sharing that data or information without anybody else. So the confidentiality agreement, anytime anybody provides any services, that is the agreement between the provider of the service and whoever takes the service. But HIT, it's even more important. In healthcare, it's more important because we are talking about not any other data, but somebody's healthcare-related information. So we want to make sure that everybody understands that whoever deals or come across with this data or information, they know what kind of responsibility comes with it. So they can protect this data, they can maintain this data, and they do not share it with anybody else who is not authorized to see it, be it other individuals or other entities. Security measure, those are the one that whoever is responsible with our data, our healthcare data, be it the administrative or physical or the technical safeguards, they will have to make sure they know how to do that, because many times whoever provides the services, they are not necessarily aware of the measures that they need to put in place, and sometimes if they forget, bad things happen. So they need to make sure they understand and also they implement that. And unfortunately, it is very common nowadays. The different kind of providers, they buy different systems and they feel that, well, they're done. But they need to make sure they understand and take those measures and turn on those safeguards. So then we have IIHI, which stands for Individually Identifiable Health Information. So it comes from, probably many of you heard the data called big data. So there are two ways to collect data. One is with providers, you go and you provide data, but then you have for some bigger purpose to find some patterns or whatnot, the government or some other entity, they could collect some data. But those data should be collected such a way where they are not necessarily identifiable or connect back to an individual. But to some extent, those data need to be scrubbed, not scribed, scrubbed. But at the same time, somehow it gives us some meaningful use or meaningful information. So anytime you have a large number of data from either provider, the plan, or employer, or healthcare clearinghouse, and they put it all together, come across some patterns, we have to make sure that how we handle the data. So you'll hear the term big data. It somewhat relates to this. And then the last one here is protected health information. So this is similarly the data on the previous line that we talked about. They are maintained and transmitted in a way where they are protected. So anytime you have, it's almost like when your bank go from one bank and take some cash and go to another branch or the head office or anywhere, there has to be a level of protection that nobody can get to it. And so it is same idea but in electronic format. So we just wanted to talk about these four different topics or define these four different terms because they are widely used in the industry, and I'm sure you have probably seen this or come across this while you are doing your work or reading any literature healthcare related. So why does it matter? Why do we care about this? Well, of course we care about our privacy and security in any industry. Think about starting from any other industry like banks or even the retail stores, or even if we take it back to our houses, we make sure that our houses are, when we go to bed, we close close our doors and lock our doors, close our garage doors, and we want to make sure, some of us put some security system. But why do we do it? Because we want to make sure that whatever we possess are secure. So here, the providers or the payers, they are the keeper of our data. So I will only have them or give them or provide them the data if I trust them. So they have to provide they have to actually provide anything and everything to gain our trust. So as a provider, where many of us work, and provider or the payers, we have to earn the trust of our customers, which are the patients. So just like the data breach happened at Target, after that, if they did not earn back the trust, people would not go shop at Target. So similarly, if you go to a clinic or a hospital or an office and their data keep getting hacked or breached, then it's unlikely that we'll go back. So it is matter for us to create an environment and provide adequate security where we can earn trust. Otherwise, we will lose customer. And at the end of the day, if patient doesn't come, may sound bad, but the business will not survive. So we have to do that. Then also,
well, the other part of that before we move on too is that if a patient is, if they don't trust their provider, they're not going to feel as comfortable with providing full information about their health. So by gaining the trust of the patient, we can make sure that their health record is complete, and that's then in turn creating an environment where providers can make wise decisions and well-informed decisions about the patient's care.
Right. So at the same time, well, we provide the data, so patient provides the data. Now, what should happen with the data? Well, what if data get corrupted? What if the data has been entered incorrectly? So that will impact us. So the trust also have to be backed up with the integrity and of the data itself that we provide. That's number one. Then also we have the availability. So if we provide them data, and nowadays, especially the new generation, they are used to having information on their fingertips. So if I go to a doctor and they tell me that, well, in 10 days I will mail you your results, I don't think I'll be very happy with that, because what I want to do is as soon as it's available, I want to log in and see it. So it has to be available to me so that I can see it. That's the expectation, whether we like it or not. And at the end of the day, it's all consumer driven. If that's what they expect and we can provide, we will not have a business. And of course, we talked about the confidentiality. We have to provide them the confidentiality. We have to make sure that they understand that their data and information that they provided us are accurate, and they can access it, and also nobody else can access it without the patient's authorization. So that's putting it all together that creates the trust. And when that happens, everybody feels comfortable, and to Tracy's point, is the patients will not hide anything from their providers, and which is a very, very critical part. If somebody goes into a place and they're not comfortable, they will not probably be open and share their information in a level of detail where the providers can do a quality job to the patient. So it's all kind of intertwined, all come together, and the biggest part of this is the technology is changing so fast. We have to make sure that we move with that. At the same time, we maintain the integrity and the availability and the confidentiality. So we move fast. It's a fast-paced world we live in, but we cannot compromise anything else. We have to make sure that we maintain the integrity and confidentiality and give them the availability. So that leads us to some of the security rules, and Jen will walk us through HIPAA.
So HIPAA's been around for a long time, since 1996. It's ever evolving because our technology is ever evolving. But basically, it's a suite of regulations, and it includes the privacy rule, which protects the privacy of the information that Moni was just talking about. The security rule, which sets national standards for everyone to follow, because if we don't all have the same set of standards, you know, people's thoughts on how things should be may be drastically different. And I think that would also contribute to the quality of the data that is collected, stored, and protected. The third thing is the breach notification rule, which requires notification following a breach of unsecured PHI. So it sets the foundation for the rules, and since it was introduced back in 1996, it has continually been improved upon. There have been additions to it and clarifications to it, and I think that because of the way that HIT grows, it has to continually grow with it and follow along with it.
Right. It's amazing. I mean, if you really look at last 15 years, I have been making a claim for last few years without any data backup, but I think I'm pretty accurate on that. What I've been saying is that in last 15 years, the impact of technology in human life has been the most than any other invention in the human history. Even if I go back to 15 years, the way I was consuming information, the way I was using technology, and to now, it's unbelievable, and how fast people are adopting this. Even not in this part of the world, in the entire world, even in the third world, the way people are adapting the technology. So what's happening, to Jen's point, is in '96, there wasn't as much technologies, but still we had the privacy rules and the security rules in places. For example, if you go check into a doctor's office, they cannot call you or address you by your last name while somebody else is standing behind you. So these are the rules protecting your privacy, right? When nurses come out, if you ever notice, they do not call you by last name. They call you with your first name from the waiting room because they do not want people to find out, okay, which doctor this person is seeing with their last name. So the point being, the rules has been in place. But what's happening in the last 15 years is that the technology is changing. So the integration of the technology is getting into healthcare industry. That means that these rules and the privacy rules and the security rules needs to be updated. So to some, it's a drag because like, well, I thought I was expert in HIPAA, but now I'm not. But to some, it's exciting because what's happening that you are keeping up with all the changes. And when you do that without giving up anything else, then you are truly contributing to the patient's security rules and the privacy rules. And at the end of the day, what that does is gains patients' trust. So when we talk about security risk, so we have all the rules in place, we have the security rules in place, still there are issues. There will always be issues. As long as we live, there will be good people, there will be bad people. Doesn't matter what kind of system we build, there will be hackers who are smarter than us. But we have to take precaution. At some point, we grow tolerance to risk. But we have to understand first what those risks are, then we can mitigate those. So there are three different categories of the risk. So if you really look at the entire healthcare, we have provider in the middle, we have individuals, the patients in the front, and then we have at the end the payers. So for the individuals, we have a responsibility. So let me give you an example. So if I have the best security system in my house, and if I keep my doors and windows open, well, somebody could come in and take it. Take things, steal things from my house, even though I have the best security system in my house. So individually, I am responsible to arming myself and utilizing those. So same here, if I share my username and a password to a friend of mine, and then they're like, oh, hey, posted on Facebook, and next day, all of a sudden something bad happened, or texted somebody, or tweeted it, or whatnot. I mean, it takes seconds to get out, right? So then identity theft happens. And identity theft is not only on healthcare, it's an issue for banking or retail or anywhere, right? So we have to be very, very careful. And the only way we can be careful if we know what to be careful about. So being such a new area, many times we don't know what we don't know. We don't know what kind of precaution we need to take. We don't know what kind of protection we should be turning on and off. So in individual level, there are a lot of risks that we have to be aware of. Then we have to understand what are the tools that are available for us so that we can utilize those tools. So moving on to the next topic is the providers. So they actually carry one of the biggest weight on these risks, because they are the one who is taking our information and then they're safeguarding it, and they are making sure it's accurate, and they're making sure also it's available to us. So they have to make sure they are giving a way for us to access their secure data. So we have to make sure as a providers, the patient safety, the communication and workflow, how we can capture the data, intake the data, and then what we can project out and who we can project out. As a provider, we have to make sure the level of detail that is important to patients, that goes securely. Also, we got to collect money, so we got to go to the payers, right? So how do we communicate with them, and what kind of discussion we have them, what kind of encryption we'll have with them. So we have to make sure that our hardware and software and the configuration and the implementation, everything is done appropriately based on who gets what kind of access. Encryption is huge. We may not realize how critical it is. All it's saying is that if you understand the internet, the way internet work is a public highway. Anybody and everybody can go there. So the responsibility is on us, is that how we can protect the packets that we are sending through this information highway, where other people cannot hijack it. Number one. Number two, even if they can hijack it, it's garbage to them. So that's what encryption is. So as a providers, we have to make sure that we provide that level of mitigation, risk mitigation, and we know what those are, so we can address those. And at the last part of is the pairs. So now the pair, they're kind of almost in the pinch, because now they have this the patient information that they have to consume, and they have to understand what doctors wrote and what kind of coding that was behind it, and then they translate it to finance. So now they bring in another layer. So now money involved, how much they have to pay, how much they have to decline, then who's going to collect what. So they have to follow the similar rules, but their risks are also very, very high. So from the patient part, yeah, there are risks. We have to figure out how to do it, mitigate that, but that's minimal. For the payers and the providers, they have to do a really, really good job Otherwise, they will lose trust and they will lose business.
Cyber attacks have been a hot topic in the news, and it hasn't just been HIT. It's been retail chains, banks, even the federal government recently. And so with this, HIMSS has done a survey just recently, and of 297 health IT executives that were surveyed, 2/3 of them reported a significant data breach in the last year. And I mean, that's huge. We don't hear about these data breaches every day. We don't hear about this large amount. We hear, I think, about the major ones, but I don't think people understand how big cyber attacks are right now.
And many of the smaller providers, they may feel that they can fly under the radar and will not be impacted by, but what we forget is that hackers are super smart. I mean, it's not just somebody who woke up in the morning and said, hey, I want to be a hacker today, let's do something. In the old days, if somebody wants to do bad things, they would probably put some ski mask on and wait till it gets dark and do bad things. But nowadays, you can be in your jammies and you're a super genius and you just hack into people's places and and there are a huge market where they can sell the information. And we have a few more information on this one, but it's really amazing how the whole paradigm of this stealing and selling in black market changed over internet.
Yeah, and I also think that talking about access and providers, it's also the access of the employees, like the different levels and who sees what, because I think that's a really important thing as well. So we have a couple of videos we're going to show you, just real short clips of things, some things you may have heard of in the news as well as maybe some things you haven't heard of. So we'll play those right now.
We are woefully unprepared. We are woefully unprepared.
Apparently, so is UCLA, which says as many as 4.5 million people may have had their personal information stolen. Things like names, addresses, social security numbers, and medical IDs. Stan Stahl of the Information Systems Security Association says hackers accessing medical IDs is a new and dangerous threat.
Other people using other people's medical ID because they don't have their own insurance.
So you can actually steal someone else's coverage.
Yes.
UCLA officials say the suspicious activity was detected last October and the breach confirmed in May, but they still don't know if any personal or medical information was actually stolen.
The timing doesn't seem right here.
Earlier this year, health insurer Anthem revealed hackers exposed information on nearly 80 million of its customers. Stahl says companies make two common mistakes. Employees unwittingly download malicious software, and IT workers fail to detect vulnerabilities in the network. He says more training and patching vulnerabilities would make all the difference.
This isn't rocket science. There are things you can do, and if you don't do them, this is the outcome.
UCLA says it blocks millions of hacker attacks every year. A statement read, quote, "We sincerely regret any impact this incident may have on those we serve. We have taken significant steps to further protect data and strengthen our network against another cyber attack."
Cybercrime costs the U.S. economy billions of dollars each year, but one business segment is attacked more than any other: healthcare. A full 51% of all breaches occur in healthcare entities. The healthcare industry is targeted for two main reasons. One, healthcare organizations fail to upgrade their cybersecurity as quickly as other businesses. And two, criminals find personal patient information particularly valuable to exploit. Cybercriminals are paid $20 for health insurance credentials, compared to only $1 to $2 for credit card numbers. 94% of healthcare organizations have had at least one data breach in the last 2 years, and the average cost of dealing with those breaches was $2.4 million. Your patient's HIPAA-protected healthcare data is at risk. It could be stolen, lost, or accidentally transmitted by you or your staff. Your network is also vulnerable to high-tech black market attacks. The following real-life incidents illustrate just how daunting the risks have become. In the first incident, an employee of a county health center had his laptop and mobile phone stolen from his car. The devices were not password protected, and both devices contained personal health information of the center's patients, including names, phone numbers, addresses, and type of disability. The total costs for this HIPAA violation are expected to exceed $150,000. The second case involved a plastic surgeon who posted before and after photos of several patients on her website. However, the code for the website was written incorrectly, and the photos that were posted accidentally exposed the patient's personal information. Legal settlements per patient have exceeded $150,000. 15 claims have been filed and 15 additional claims are expected, with a total cost of over $4.5 million. Will you have a data breach or get hacked? Yes. It is not a question of if, but when. What can you do to mitigate your risk and exposure to cyber attacks and data breaches? Here are 8 steps every medical practice should take. 1. Develop a data recovery and/or disaster plan. 2. Create, document, and use enforceable cyber and data breach procedures. 3. Train your staff on your procedures. 4. Encrypt all computers and devices with passwords that are composed of numbers, letters, and symbols. 5. Protect your facilities by securing building access, shredding documents, and installing firewalls. 6. Have separate office and guest Wi-Fi networks in your office and/or practice. 7. Install endpoint security software, including antivirus, anti-spyware, and anti-malware. 8. Buy insurance coverage to mitigate your risk. MediGuard Plus is an exclusive insurance solution offered by the Doctors Company. MediGuard Plus coverage provides enhanced regulatory and cyber liability coverage for medical practices. Coverage includes $1 million limits for patient notification and credit monitoring costs, network security and privacy insurance, network asset protection, cyber extortion, cyber terrorism, multimedia liability, privacy regulatory defense, and fines and penalties. To ensure that you and your practice are well protected, we encourage you to review your insurance portfolio regularly. Contact your agent or the Doctors Company to mitigate your exposure today.
All right, so those are important things to think about. We don't often know that, or we don't often hear that healthcare is at the forefront of some of these cyber attacks. And as Moni mentioned, the smaller providers often think they can kind of fly under the radar, but hackers are really getting smart, and they're focusing on those smaller providers because they're less likely to fully protect themselves. So what are we doing about this? We can talk about what the ONC is now doing to help improve this situation.
So the ONC is playing a very active role in health IT safety recently. They have come out with a guide, and they have 3 core things that they want to look at, and I think that it's really going to help. And it's not only HIT security, it's also the security ties in with patient safety, and to make sure that not only are we keeping the information secure, we're also keeping our patients safe. So the first thing is they want to learn, increase the quality and quantity of data and knowledge about health IT safety. I think that people don't have enough information sometimes, or they don't quite understand the ramifications of sharing a password or letting somebody into the system to look at their records, things like that. And so I think that that's the first step, is to educate people and let them know why we're so strict on our security rules, why you may only have this kind of access, you know, when somebody else has actually access to go in and chart things and do things, and you may only have access to view it. So I think that once that they have gotten through that step of educating, their next step is to improve. So They want to target resources and corrective actions to improve health IT safety. So once they've learned what the barriers are to improving, I think that that's the next step. Then they find out how they're going to improve and come up with their plan, and then they want to lead. They want to lead the industry and promote a culture of safety related to health IT. And I think that's very important in gaining people's trust.
So, as I mentioned a little bit ago, we don't know what we don't know. And sometimes we learn it hard way, but ONC took a stance here and said, hey, you know, before you learn it in a hard way and make all the mistakes, why don't we come and help to set some guidelines, set some standards, and help you as a provider or anybody who is involved in healthcare industry, and so that you can protect yourself. So not only just setting up the guidelines, and that is the cool thing about ONC, they just didn't set up the guidelines. I said, okay, here you go, and do it yourselves. They are providing all the tools. They are providing the knowledges from the top guns in the U.S. and giving anything and everything that we need. But at the end of the day, we have to consume that. We have to integrate that, and we have to implement that. Otherwise, it will not happen. So, so in my mind, they have done an awesome job taking the approach that they are taking. So here, they are in their safety plans. They have a couple of goals. Of course, make everybody aware, as Jen was talking about, learn and improve. And some of the other goals here is, at the end of the day, we want to make it safe. So to do that, if we make that the center, the core of everything, then it is probably easy to work from there. So if you look at this this picture here, it's put the patient safety in the middle, then, okay, well, identify what are the things that we need to worry about, what are the things that directly ties to it, what are the things that are indirectly tying to this. So what are some of the high priorities, what are some of the hardware, software, or hardware infrastructure, some of the system interfaces, what are the integration that we have to do to provide the patient safety. What are, the patient ID? Are we going to use their first name and last name as an ID? Or are we going to mask it and give them some different ID, and then we'll use some other technique so that people would, even if somebody gets the ID, they may not find out who they are, so on and so forth. So understanding how to keep our patients safe, and if we make that as a core of all our approach, then we can define all the activities and the tasks around it. And ONC is providing all of that. So the roadmap. So they are providing the support. They are providing the knowledge. They have lots of programs, but they are also laying out a roadmap that this is how you do it.
Okay. So again, I think that they're reiterating that, using health IT to make care safer, not only make it more efficient and to make it more readily available for everyone involved, I think that the goal is to make care safer, to improve on that, use the data collected to see where we can improve upon things. And then that just leads into the continuous improvement upon that. I don't know, maybe we can stop for a second and just see if anybody, I know that I've seen it personally, but I know that there are always constant improvements being made, but I've seen a lot around safety and patient safety and just in general in my areas, but I'm wondering if other people have any comments or are starting to see things as well.
So if you want to contribute something, maybe an example of how you've run into these issues, just go ahead and unmute yourself in the webinar, and there should be, just right next to your name, a little microphone that you can click on. We'll just give you a few seconds to chime in, and if not, that's okay as well. We'll have an opportunity at the end for you to ask questions and discuss things with us and with each other as well. Okay. That's okay. We'll continue talking about some of the goals of this roadmap and of the Health IT Center that the ONC has sponsored. So some of them are understanding what the shared learning and shared responsibility is in this initiative, and to be solutions focused, building upon some of the private sector initiatives, because of course private sector typically has more resources to come up with new initiatives. So the government can kind of model some of those piloted programs, and of course we have someone who unmuted themselves. So we'll continue for now and then give you the opportunity to chime in again at the end of the session. So then forming those public-private partnerships is important. So you see that coming up more and more. And we're going to have some more news on what Normandale is doing to contribute to those initiatives soon. So watch our website for more information on that. And then just being transparent about what some of these initiatives are and creating that environment where where patients feel like they understand what is being done to protect their private health information and protected health information and keep them safe in the healthcare settings.
So this is just an illustration of the roadmap. It's just basically showing how the current environment, how things are. Everyone is kind of siloed a bit. Nobody is completely working together or in tandem. The Health IT Safety Center would like to bring that together and form partnerships and just make people more aware all around, and so that way we can work together. Because I think that when you're working separately in your own little space, it's easier to miss things or make mistakes or undo what somebody else has already done.
Or duplication of effort.
Yeah, definitely. And so then it comes to the Health IT enabled learning, the learning health system that we kind of touched on last time. I think Tracy talked about that a little bit.
It's something, I'm sorry to interrupt.
No, go ahead.
If you joined us last month or if you watched the recording, it was at the tail end where we talked about what the Minnesota eHealth Summit was. We went through a couple of topics that they covered at the summit, and creating this Health IT enabled learning health system is an important initiative, especially in Minnesota. So you'll see this little graphic on the screen is tying into the same thing we talked about last month. So it's important to learn from what we're doing and have that feed into adjustments that we make to improve the systems and then learn from those changes and continuously improve.
Yeah, accepting the fact that we can't be at the top just overnight, and every practice is unique to some certain extent, but as long as we have an open mind and we just keep learning and keep improving, so adapt, utilize, and exchange, and we can keep doing that, that will lead us to a very, very safe system that helps everybody, not only the doctors or the providers, but also the patients and the payers. And this is not a new model. I mean, if you really think about it, anywhere, anybody in any industry want to do any improvement, nobody was able to do it in just one shot. It's not necessarily a new pattern. We are just trying to learn from the industry and just trying to understand what are the best practices from the industry and then mapping those to our healthcare industry. So, I mean, to most of you, I'm pretty sure this is nothing new as far as the process goes.
It's nice to see the government embracing some of these things we've always known all along.
Right, right.
So we'll kind of move into the next phase of our learning community tonight, where we'll talk a little about what's happening in the industry. So if you are signed up for some of these newsletters, e-newsletters that are sent out by the ONC and HIMSS and some of the other active organizations in health IT that are their initiative is to help inform people working in the industry. You may have seen this Health IT Safety webinar series that is happening. So we are at the 8th webinar in a 10-part series, which I believe has been recorded and are likely available on this website. So there's an upcoming webinar on July 30th, and when we publish this presentation, we'll make sure that the link is active in the description of the video, so you can see how to get signed up for that and hopefully join that webinar. The other thing that we had just within the last month was the Minnesota Rural Health Conference. And if you are part of our mentor grant, or if you are familiar with what Normandale is doing with the HIT program, you'll know that we're very active in the rural community and training rural providers in health IT and trying to move initiatives forward for some of these smaller providers who have very few resources to train people and to implement and optimize and make these systems interoperable. So with that, we were at the Rural Health Conference. We did a presentation on creating a workforce that's educated in health IT. And the link that you'll see on the screen is actually where you can find some of the presentations and some more information about what happened at that conference. And then upcoming conferences are in October. We have the HIMSS organization has their Midwest Technology Conference. So obviously that's just in the upper Midwest area. It's being held in Detroit, Michigan. It's not as huge as the overall HIMSS conference. So there likely won't be 30 or 40,000 people there.
Yeah. Which is not a bad thing.
Right, because it gives you the opportunity to connect to probably connect more with people who are closer to us geographically, as well as then in turn what's happening with National HIMSS. So that's coming up if you have the opportunity to go to that. Just wanted to make sure you're aware what's happening. And then also, so you have the links for staying connected with us and what's happening in our state and our country in health IT. So we have our website, of course. We are on Facebook. We're in LinkedIn. I know we've just started to become active in Facebook, so keeping it professional out there. Anyway, we have
no cat videos.
No cat videos, I promise. And then, of course, healthit.gov is important, a very important resource for people who are touching this industry at all. HIMSS, of course, and then the Minnesota eHealth community. So make sure you check those out. And now we'll just open it up to anyone who'd like to make any comments on what we've talked about or ask any questions of us. It doesn't have to be about this presentation. If you just have a question about maybe the classes or the program, or if you're having any issues.
Or share any experience
that
are relevant
definitely.
to this. Maybe you witnessed some data breach or whatnot.
This is Angela Marshall, and I don't think we're doing anything different than everybody else. Everyone's, making, has a deep bench of layers of safety precautions in place, and probably changing all the time as the technology changes. But I do find it interesting that, at the Joint Commission level, safe use of health IT information will become a sentinel alert events, or already has. And so I think that just kind of heightens the awareness of our need to make sure that we have things in place so that we can prevent errors, detect errors, and just maintain the quality of what we do in the health IT world.
Absolutely.
Right.
It's a very important point. Thank you for sharing that, Angela. Would anyone else like to share anything? Okay, well, I wanted to add that we have, so we went through some of the privacy and security issues in this and creating awareness and some of the things that need to be looked at. Next month, we will talk about mitigation and managing those risks and what you can do about them some more, in more detail. We felt like we didn't have enough time this session to go through absolutely everything. So next month on August 20th is our planned learning community. Pending any scheduling issues, we have some work with the ONC that we're doing that I haven't even told our team yet that may conflict. So they may be on their own next month. But at any rate, we have August 20th planned, same time, 5:30 to 6:30. We will record it, and hopefully everyone can join us again. So anyone have anything to add, or should we just sign off a little early?
Thanks, everyone. As always, it's been fun putting this together and discussing this, and it's very, very relevant and live, and it's just not the theory. And we are in a stage where any knowledge that we can get from here will make a huge impact to the places that we work. So it's a very, very good place to be in. So, well, thanks everyone for joining and giving us the opportunity to present.
Yes, thank you. Thank you. Have a good night, everyone.
Yeah. Bye-bye.
Bye. Take care.